Welcome back to Recharge. Dr. Gene here. So, if you've been listening to our podcast, what we've really found effective is when we cover something in an episode to do a video and give you guys like a visual guide or a way to follow along and really get some actionables. So a few weeks ago, or I really don't have concept of time at this point, but at some point in the recent past, we did a podcast talking about persistent back pain or chronic back pain. Actually, we talked about all kinds of pain that you have for a while. Way back, a month or plus ago, we did an episode on acute back pain or just a sudden onset of pain. And we did a video about that. So you can look back in the YouTube playlist. And we did that several weeks ago as well. So if you ever have an onset of back pain or any back or any pain, you know how to deal with it. And it was a very intensive, detailed video that we did for you guys. And so is the podcast. But on this video, we wanted to go over what happens if you're dealing with pain for months or years. And there's a lot of you, a lot of us, Corey and I talked in the podcast that we've dealt with pain in various areas, particularly in low back pain for years. Corey's recording this video and he's like shaking right now, doing a little dance because even talking about it makes you feel things. It's kind of like saying if you have to sneeze or your nose itches, you really want to kind of get in there because you start to feel it. And pain is that like that in a lot of ways too. So back pain, low back pain is the most common medical condition in the US. It's a huge burden on the medical system, and a lot of you deal with it on a daily basis. And we help our members at Recharge not just deal with it, but manage it and get stronger while having pain. And that's such a big concept to process. First of all, it's not all about getting rid of pain because that is a process that has a lot of uncertainties. We can't predict or we can't say very clearly, do this and pain will go away. So, with that said, you have to be able to manage and live with pain. And to live with pain, you need to have a strategy. So, in this video, what we want to cover is give you some actionable, some things to do if you are dealing with consistent or persistent pain. And I'd like to break this down into two categories that you might not have heard of or thought about. And we're going to break these two categories into unloading and underload. Now, we'll go a little bit more detail into each, but I'll give you a brief little description. So, unloading is like if one of the common things people say is, I get out of bed in the morning and I feel super stiff, or like the first few steps are like, So, at that point, you might want to unload, meaning take a little force off certain areas or certain tissues that might be causing it and give you a little bit of relief. That's unloading. And then underload. Now, I don't want you to confuse this with underloading, which is meaning you're not giving yourself enough load, which if I had to bet Corey's nickel, most of you are doing when you're in pain. He doesn't have a nickel. What most people do is something called fear avoidance. When you have pain for prolonged periods, even when you have pain in the moment, your body instinctively compensates away from the pain. So you don't want to hurt. Therefore, you do things that keep you from hurting. And you do that over and over and over and over again. And if you can imagine being in pain for months, that means you create new patterns. So when you have that pattern of pain that persists, certain tissues do not get worked as much, and certain movement patterns don't get worked as much. And you become very fearful of those movement patterns. And that starts this loop, this cycle of pain, because anytime you try that movement pattern again, sometimes reflexively, sometimes by accident, and you feel some sensation, your brain goes, oh, I told you this was bad. And you believe it and you avoid it even more and more and more. Whereas the reality is, if you gradually go into those movement patterns after a month or so, because your tissues have healed up, right? That initial issue, whatever it was, if it was a tissue disruption, whether it was a disc herniation or a muscle strain, whatever it was, has healed up by now. So now it's about letting your brain and your nervous system process that, and for you to prove to yourself that it's okay to do those things. And if you have a plan in place, then it's about gradual loading. And that's what we're going to show you today is some strategies, particularly for low back pain, that you can use under load, how to use your back under some load, under force that is safe and gradually effective. So that's the intro. I know it's a lot, but there's so much nuance. There's so many little things with pain that we could literally make hour-long videos that some of you might enjoy. But for this segment, let's get into some actionables.
All right, let's take a look at the first exercise. And this is really just to change the hinge point of the back. So Corey's using a belt like material, and you can use pretty much anything, a towel, anything with a little length on it. And you can put it a little bit above your low back. And Corey here is just crossing it and going on all fours with his hands on it, and then applying upward pressure. So that upward pressure, it pulls up on your back, and then as you sit back, it applies almost like a traction feeling. So it feels pretty good. Again, it changes the hinge point a little bit more from your low back to your mid back. And then, as you can see, you can make adjustments. So you can move the band or whatever you're using a little bit higher up, a little bit lower down. Again, I'd keep it a little bit above the low back area. So this is more for the mid back area. As you move back and forth, again, try to maintain consistent tension on the same position in the same area as you keep moving back and forth. Next movement that we're going to get into is more for neural tension. So, what I mean by this, if you bend down, like Corey's trying, and try to touch your toes and you feel tightness in the back, it's not always because of tightness. It could be because of the nervous system. So, this is a great way to test that out or feel looser without actually having to stretch anything. So, what Corey's doing, he's grabbing his ankles and maintaining that position and then moving his knees backwards, straightening his legs. And that's putting tension on the sciatic nerve and a lot of other superficial nerves in that posterior chain or the back of the thigh and hips. In that position as well, you can actually arch your back a little bit. So you're now going to get a lot of range of motion and you don't need to. What you just want to do is put tension on those nerves and then move your back and forth to move those nerves a little bit more. So again, you can go back and forth with your knees, and then it's always great to retest. So you can bend down again, and as you can see with Corey, he's got a lot more range of motion because he worked his nervous system. All right, the last of the unloading videos that we're going to look at as we see Corey attempting his acting skills is a great kind of traction using gravity for our benefit here. So this is the reason Corey was pretending to yawn, or maybe he was yawning. It was a long shoot. He might have been getting a little sleepy. Is to when you get up when you feel really stiff and achy. This is a great way to swing your legs off the bed, grab on to the mattress, or just have something that you can hold on to with your hands. Let your pelvis hang off the edge of the bed and then take some deep breaths and let your knees and your thighs kind of pull you down a little bit and then move your pelvis in and out. Again, establishing some early range of motions for your back and your spine that might feel a little stiff, using gravity to your benefit. Now let's get into some underload. Let's load the back a little bit, but it's not just loading the back, it's loading the tissues around your back while introducing movement to your back. And every time I'm watching these and doing this voiceover, I'm tempted to say this is my favorite one or one of my favorite ones, but they really are. They're so effective and simple to do. So this one is you're doing a row motion, which activates your lats, which attach from your shoulder down into your pelvis. So it incorporates, it creates tension that involves your low back. So by doing the pull and the row, you're activating your lats, and then under that activated position, you're going to move your pelvis back and forth, back and forth. And this really allows your back to experience tension around it while moving through it as well. And this is a deadlift or a hinge tension hold. So this is usually my go-to when my back acts up. You can use bands. You can use anything that has a little tension into it. You can use a barbell as well with weights on it. But the idea is to get into a hinge motion, apply tension upward, like you're trying to straighten up, and then hold it isometrically. Here, Corey is also doing some pelvic tilt while in that tension position. You're going to hold it 10, 15 seconds. You're going to feel a lot of burn, a lot of tension generation. Again, a lot of activation in that back. All right, the next three movements that you're going to see are kind of progressions of themselves. And this is a progression when you are trying to have a little bit more load. So you're playing with some levers, moving a weight away from you, and you're also working with some single leg stances, as you can see Corey doing here. So loading the opposite leg, weight, and leg. So you're standing on the leg that you're trying to load. The weight is opposite of it to create this co-contraction. So if you're holding the weight on the left side, you're going to activate the right glute. These are, again, really, really great if you are still fairly sensitive and tender and sore. It's a great way to start that. This is a progression when you're feeling a little bit better and you want to play with further or extending the lever. So you move the kettlebell further away from you. That activates more of the muscles around it. You can see Corey snickering because everything was burning for him at the time he was doing this. So this starts to activate everything. By going around, you activate the abdominals, the back muscles, the obliques, shoulder muscles. So it's a great way to activate the entire system with motion. And then we're going to progress into a hinge single leg stance. You're still integrating this directional movement, but now you're in a hinge position that activates the back muscles and the posterior chain in a single leg stance while creating this dynamic element of the kettlebell or any weight that you have. You can move around to do this, and it feels pretty good. All right, let's take a look at the last movement. I actually created this years ago when I was working in the clinic and seeing a lot of back pain patients. And this one worked really, really well for pretty much everyone. So, this is one of the universal ones. What you're doing here is you're using bands or anything with resistance, again, to activate the lats, to create some tension in that posterior chain from the shoulders down into the pelvis. And then while doing a glute bridge, you're creating some motion with the pelvis. So you're moving back and forth, leading with your knees. So Corey's going to show the bands going down, creating tension, hips going up, activating the glutes, and then pelvic rotation back and forth. And you're really touching on some of that transverse plane while creating tension or some activation in the sagittal plane. So this again works really well to engage the muscles around the back.
All right, that's it. Hope you enjoyed that, or at least found it useful. The Obviously, when dealing with pain, it's so unique to each one of us, right? Like even when we were recording this, both of us were doing different jiggles because we started feeling different aches and pains, and that's kind of what pain is in a lot of ways. It brings about connections to your past, to your fears, to your hopes. I mean, not to get too deep here, but that's what pain brings about. So, some strategies for you to use.
Yeah, try a couple, see if one works really well, stick with that one. Try them all. If you don't like one, maybe skip it. Maybe that one's not for you.
If you found this useful, if you want to see more, go ahead, subscribe to the channel. Let us know what you think in the comments below. We'll keep putting these out. Head over to iTunes podcast or Apple Podcast, Audible, Spotify podcast if you want to listen in more detail to our podcast called Movement is Medicine, where we go into a lot of these details a little bit more nuanced and connected to training like we do at Recharge. Catch you again on the next episode, on next video. Make sure to subscribe.